No, I have to go to bed. That's like, it helps me to get more sleep because I have to go to bed by like 10 o'clock, or I'm actually like falling asleep at like 8:30, and then I have to turn to my wife and be like, hey, can we go up to bed? And if she's like watching the end of her Young and the Restless or reading a book or something, she's like, no, I don't want to go to bed yet. So I just like kind of pass out on the couch and then I get up and go to bed when she's ready to go to bed.
Hey, Sam.
Hello, how are you?
Good. How are
Good.
you?
Good. I was telling Rachel earlier that unfortunately I can't stay the whole time because there's a PGY2 event tonight at 6, but I'm happy to stay for as long as I can. And thank you both so much for being here. I think that with summer being here, wellness is a nice topic. Hopefully people have time over the summer to take some time for themselves. So I'm looking forward to hearing what you all have to say this month. Thanks again.
Yeah, totally.
Sure. It's fun to do this, especially with Jonny. Have we done something together before?
No, I remember we first chatted a long time ago when I was sort of talking with oh shoot, why did her name just go out of my head? Your old colleague in the integrative medicine,
Susan Gaylord.
Susan Gaylord, yeah. And she's like, oh, you got to meet Karen. And you and I talked for like 10 or 15 minutes, and like, we were resonating on things. And then it's like, oh, we got to catch up. And then like 6 years went by.
Wait a minute. Didn't you go to Central America or something like that?
Yeah, we moved to Costa Rica in 2018 for 6 months. Yeah.
So we had a conversation, like we went out to lunch or something before then.
Yeah.
Because I remember you were leaving.
Yeah. Yeah. And then we never really reconnected all that well. And so, you know how it is. We get in our little grooves and, we're doing our parallel things, and that's that. But yeah. I'm very impressed with your work. I wish I was like incorporating it more. So I'm looking forward to hearing from you today.
Okay.
I love that phrasing that you use, the parallel work. And I think that's kind of the purpose of the Alumni Society. And we're trying to move it more towards in that mindset, right? Of like more perpendicular work. How can we cross one another more often? And I know within the department, the water cooler talks on Mondays is great for folks who are still on campus and for the trainees. And the goal of these monthly webinars, just to serve as an extension of that for folks who are alumni and out in the community and maybe no longer having access directly to on-campus resources or evidence-based topics, or learning what's new, what's going on main campus. So I appreciate you both for being here tonight. Sam and I are forever grateful for the speakers we have and appreciative of those who are able to attend tonight. Looks like we have a couple of faces who've joined us, and I'm sure more will come. Historically, the last couple of months, we've probably had anywhere between 10 to 20, 25 people join us at any given time. And given that this is after work, evening hours, I know folks are shuffling through and organizing family in the background. So feel free to turn on your cameras if you're inclined to, turn them off if you need to. We're just happy that you're here, but we'll go ahead and get started. If it's okay with y'all, I'll introduce the two of you, and then I hear you guys are going to tag team a little bit, and you'll go away. Okay.
Yeah.
So for those of you who don't know, we have the wonderful Dr. Jonny Gerkin today and Dr. Karen Bluth. Jonny is a psychiatrist and associate professor of the department, and he primarily focuses on general psychiatry and consultation liaison psychiatry. Unless things have changed drastically since I've been there, Jonny is a primary teacher on the main campus for acceptance and commitment therapy, and you do a great job, from what I remember, of incorporating that in all levels of teaching, from medical students to the residents to the fellows, and overseeing the consult liaison fellowship, as well as some physician's assistants and some of the counseling interns. So while I was there, you actually launched the Mindful Mondays program. And I think that's grown to even larger than just yourself now. So it's campus-wide, I believe. And hopefully that's still going strong every Monday afternoon, open to pretty much everybody at UNC, faculty, staff, and trainees, as a way to not only help ourselves get a little more zen throughout the week and learn how to use ACT in our daily lives, but also potentially extending that to our patients, which is great. Dr. Karen Bluth, I have not had the opportunity to work underneath directly, but she is a psychologist and assistant professor within UNC, and her focus is on mindfulness and self-compassion. Specifically, I take it within adolescent populations, and does a lot of research, which is very impressive, on focusing on behavioral interventions and testing, so that adolescents can learn more about their own coping skills and navigating the implementation of those during that pretty tough time, which I'm learning there are a lot of adolescent referrals in the community, people who need our help in a big way. And those of us who did not do CAP training, I'm very grateful for what you do, because it's very helpful work for us. And you're learning also, or you're working on implementing some of these skills in the classrooms, which is great, so that it can take the load off of a lot of the providers in the clinical setting and maybe incorporate that more in this teaching educational system. So we appreciate all the work that both of you are doing, and we're excited to hear what you have to say tonight.
Thanks. Yeah, great introduction. Can everybody hear me okay? I got these like super cool AirPod Pros now. I'm like feeling so young and hip. They're good for exercising, I can tell you that. All right, so I think what I'll do is I'll just share. Okay, host disabled participant screen sharing. Sam, can we share? Can we have that capacity? I'm going to share some slides. We don't have many. We're going to try to be brief enough that there's some time at the end for some questions. And I'm going to actually probably work a little bit backwards, just in case a few folks join a little late, so they won't be joining in the middle of a practice. And so I'll probably start with like slide 3 or something, and then work backwards. All right,
Try
good.
it now.
Like
I changed the settings.
yeah, I'm good now.
Right. Sorry about that.
No worries. All right, so you all see the mindfulness and self-compassion title slide. Yeah, we were real creative with the title, but I think it was more like, I mean, what's in the title? You know, we could have come up with something catchy, but we didn't. Okay, good. All right, so we're going to come back to this. What I'm going to talk about real quickly first is the idea here for me, why ACT sort of became a focus of mine, coming through a portal of pretty generic, like run-of-the-mill mindfulness meditation practice that started about 11 years ago now for me. I was basically learning to meditate after coming across this book that my wife had ordered, Mindfulness in Plain English, by this Sri Lankan Theravada Buddhist monk named Bhante Gunaratana. I one time said Gunaratana, and Amy Weil, whose husband is Sri Lankan, she chuckled. She's like, it's Gunaratana. I'm like, oh, great, thank you, appreciate that. It's really nice when someone corrects you like that, so you can, like, you know, correct how you're saying things. So anyway, I needed to learn a way to increase my resilience and my compassion, because I was burning out as a junior faculty person. And so then it was something that was so compelling for me that I decided, well, I've got to incorporate this into my work. And so I learned some mindfulness-based cognitive therapy, some mind-body medicine skills, but I was having trouble getting clients to take up meditation and these practices more formally. So then I got into this like expansive space where I thought, well, am I going to have to adapt DBT? Is this going to become my life's work now? DBT is so manualized and so detailed. I was just like, there's no way. Like, I would have to quit being a psychiatrist to like master this. And then I heard a woman named Lillian Dindo give a talk on ACT at a cancer support program, Grand Rounds. I think it was in 2012. And it took me like a year and a half or so, but I started to get into that, and I got a junior faculty development award and used it to pay to go to the International Association of Contextual Behavioral Sciences conference, which is the ACT Guild conference in lovely Minneapolis, Minnesota. It was a summer, so it was actually pretty nice. But I was just like, man, of all the years I get it paid for, it's in Minneapolis. Like the next year it was in like Sevilla, Spain or something, you know? So anyway, that was my first training, and because they do these like pre-conference trainings. I don't know if other psychiatrists on here have ever gone to a psychotherapy conference, but they're so much better than psychiatry conferences. I mean, it's just, in the psychiatry conference, everyone's all kind of like, you know, competing with each other. And, you know, the lecture's all very stiff, but in the psychology conferences that I've been to, it's like everyone's chill and hanging out. You're wearing flip-flops, you know, you're having group therapy sessions. It's great, it's the best. And you get to rip on psychiatry like you're not a psychiatrist, which is good. So anyway, I started to learn ACT and just found that it helped me to start to help people develop the same kind of core sort of skills that a meditation practice does. And it also helps you to know like kind of how to move from a place of presence to taking more action. And so the central tenet of ACT is this thing called psychological flexibility. And as you can see here, it's really this ability to stay in the present and in contact with the present moment, regardless of whatever's coming up, rather than trying to change or control anything that's coming up. And so that's why the difference between like a third wave cognitive behavioral therapy and a second wave one is that in the second wave, which is sort of standard CBT, you're doing some work to change our core beliefs and change our sort of thoughts and emotions, or at least change in a way, coming up with alternatives to like sort of also have there to try to see if you can find a different kind of balance. You move away from that kind of direct action on the inner experience and move towards how do I relate to these things, validate myself, not act out to control them directly, and put more effort into moving towards meaning and what's important. And so values, as it mentions here at the end, become very important. And so it's interesting because ACT compares favorably and similarly to CBT for symptom sort of outcomes, but it's not targeting symptoms. It's targeting this thing called psychological flexibility, which has made it interesting with the literature. I think they have around 200 randomized controlled trials now in ACT, and that they're all, you know, similar to CBT with that outcome, but it's always a secondary outcome in ACT. The primary outcome being often a scale that they use to look at this. So just really quickly, there are 6 processes in ACT, which can feel like a lot, but when you come from like a more traditional like Buddhist approach, it's nothing compared to this 37 factors of enlightenment. So I thought 6, like that's 31 off, like that's great. But these actually can go into 3 pillars, which makes it even more simple. And the 3 pillars are open up, be here now, and take action. And so the open up is acceptance, which is sort of a pretty loaded term. So we'll often say, see it as it is, allow to be there what's already there, like in DBT, make space for, uncover space that's already there. And then this thing called cognitive diffusion. And so diffusion is a made up word, but it's supposed to be the opposite of fusion. And I think this sort of gentle distancing from your immediate experience is sort of how to think about it. Some people use the word detach, but that feels strong to me. And so distance, this sort of thing. And you can think of fusing as like, here's my thoughts and feelings, and here's the self that I identify. And what we're trying to do is sort of just create that little bit of space there. And that's where we act from. So be here now, they have a process called present moment awareness, which is essentially mindfulness. And I think they want to downplay the mindfulness term a little bit in the ACT group because they worry that it gets people to associate with, you know, something that's spiritual and this sort of stuff. And they're worried, they want this to be very secular. And then this thing called self as context, which is really emphasizing this observing awareness, observing kind of self, that it's been around in a lot of psychotherapies. There was this psychoanalyst out in San Francisco named Dykman who was really all about the observing ego and really trying to push that during his career. He passed away maybe 8 or 9 years ago, but he was sort of hitting on this as well. And the idea of like self as context is you get better at recognizing that you're not your roles in life. Like all of us have like 20 roles. You're also not the content of your inner experience. And so there's the context out here in the world, and then there's our inner sort of experience that's related to that, but also just kind of comes up on its own. And seeing yourself contextually, if you can increase your ability to be accepting and present with whatever's showing up inside, that's kind of like the best inner context is sort of what the goal is here. And then there's taking action. And so for me, what I found is the more challenging work, and I think another reason I've been drawn to this kind of work is that in psychiatry, you know, traditionally psychiatrists were, you know, folks who decided I'm going to go try to help these people that are locked in asylums because we don't know what to do. And so our training over time really has been helping people as best we can from like getting off the bottom of the ocean and getting their basic needs met. And we do really, great training for that. And then we learn some psychotherapy, but what we don't get a lot of, unless you put it up, take it up on your own, is like, how do you help people to kind of really figure out and find meaning for themselves? And so this approach really sort of focuses on that. And we help folks to look at what's important to them, and then they take committed action, which is a commitment to moving in the direction of what's important to them. And so a lot of the work then is developing the skills in that area. And last thing I'll say, and then we'll move to the practice, which kind of unpacks some of this stuff in a sort of a guided approach, is, shoot, what was I going to say now? I was talking about committed action. Maybe it'll come back. At the bottom of the slides here, I don't know if we share these slides directly. These are links. The top one, get out of your mind and into your life. Steve Hayes is one of the sort of founding members of this approach. The intro and the first chapter are worth a read if you want to like hear more about the foundational sort of, philosophical and theoretical approaches. And they did around 20 years of research that they sort of say is related to evolutionary science and sort of a language-based consciousness and derived relationships and all this stuff. And he unpacks that a bit there, and then it's basically a self-help sort of workbook after that. And then the second one, in this moment, Strassel and Robinson is this like psychology power couple out west who've done a lot of work with primary care, and they do a focused version of ACT. And that book I really like because it breaks down sort of these types of processes into like a 5 sort of faceted mindfulness practice that you integrate into your life, where you practice observing, describing, using language descriptively, getting a little distance from your experience, taking care of yourself in the moment, and then taking action mindfully. And so a lot of times, this is what I wanted to get to. Somehow I got back to it. Clients will ask us, what do I do? Which is, as a psychiatrist, you're trained to answer that with some kind of question, which I've never liked to do. I've always thought that's like a total cop out. Like, well, why do you feel like I should be the one that helps you to know what to do, or whatever it is. And so now I just say, well, first we observe, and then we use language to describe what's showing up, and we'll have a little distance then. And then in this moment, we take care of ourselves. We validate where it's at and how messed up whatever the situation is, or how hard this feeling is. And then we decide what to do mindfully, which is to say, based on what you care about and what this situation affords us. And so that's what we do. And so let's do that now. And that was really helpful to me, because so many times we get into these uncomfortable spaces because we have to, like, we got to help people to figure out how to get out of their comfort zone to get to where they want to go. But in the moment, they're maybe not equipped for that. And so it's nice to like meet that with some kind of, even though it's kind of abstract, it's made very concrete. So that's what I'll say about that. Who can name this stage? Where is this from? Do you know what play this is? Broadway play? This is Rent.
It's Rent.
Yes, I beat you, sorry. Yeah, this is Rent. So
I was trying to unmute.
Yeah, that's how it always is. So I'm going to end the show just for a second so I can have my cheat sheet. And we're going to do this practice, and I'm going to go through it kind of quickly just so you guys can hear. Hey, Mike Kane's in the house. But this practice has 8 parts, and you may notice if you pay attention, it's kind of, each part is kind of dealing with some of those processes that I brought up to you. And this is really meant for like, if you had unpacked some of this approach with a client, and then you were saying, well, let's do this practice, this guided practice to give you a little more experiential sense of this. I've done this before with folks, and it like really helped them. I've actually had another couple clients where you're halfway through and they're like, this isn't working for me. And so bear with me and see what you think. Rachel may have been through this already, because one of the crazy things I did a couple years ago was add a focused acceptance and commitment therapy group to a med management clinic, and she was subject to that crazy experiment.
That's part of the training.
Yeah, that's kind. That's very kind. All right, so here we go. All right, so I invite you now to sit up straight, let your shoulders drop, and gently push your feet into the floor. And get a sense of the ground beneath you. And you can either fix your eyes on a spot or close them, whichever you prefer. Now, just take a moment to notice how you are sitting. And notice how you are breathing. Notice what you can see. Notice what you can hear. Notice what you can feel against your skin. Notice what you can taste or sense in your mouth. Notice what you can smell or sense in your nostrils. And notice what you are feeling. Notice what you are thinking. Notice what you are doing. So there's a part of you in there that can notice everything that you see, hear, touch, taste, smell, think, and feel. We don't have a good word for this part of you in everyday language. I'm going to call it the observing self, but you don't have to call it that. You can call it whatever you like. Life is like a stage show, and on that stage are all your thoughts and all your feelings and everything that you can see, hear, touch, taste, and smell. The observing self is that part of you that can step back and watch the stage show. Focus in on any part of it, or step back and take it all in at once. Now, take a moment to reflect on why you came here today. There's something that matters to you, something that is important deep in your heart that motivated you to come here. Is it about improving your life, personal growth, learning new skills, building better relationships? Is it about improving things at work or with your family or your friends? Or perhaps it's about your health, nurturing your body or enhancing your well-being. Just do a search deep inside your heart to clarify what values led you here today. And now take a moment to reflect on how you got here today. You didn't get here by magic, except for Zoom seems to be full of magic. You are only here because of committed action. You had to organize the appointment. You had to reschedule things. You had to invest time and effort and energy to get here. And chances are that getting here today brought up some uncomfortable thoughts and feelings for you. And yet here you are. And recognize that right now in this moment you are taking action. You are sitting here in a chair doing an exercise that probably seems a bit odd or unusual. And you probably have all sorts of thoughts whizzing through your head, all sorts of feelings passing through your body. And there are all sorts of things you could be doing right now that are much more fun than this. And yet here you are, taking action to improve and enrich your life. Now for the next few breaths, I'd like you to focus on emptying out your lungs. Push all the air out of them until there's no more left, and then allow them to gently fill all by themselves. Really notice the breath. Notice it flowing in and out. Observe it as if you're a curious scientist who has never encountered breathing before. Notice how once the lungs are empty, they automatically refill all by themselves. You can take a deep breath in if you want to, but notice how there's really no need to. The breath just happens by itself. And I invite you now to undertake a challenge for the next couple of minutes. Keep your attention on your breath, observing it as it flows in and out. You will find this hard to do because your mind is a masterful storyteller. It will tell you all sorts of interesting stories to grab your attention and pull you away from what you're doing. See if you can let those thoughts come and go as if they're merely passing cars just driving past outside your house. And keep your attention on the breath. Notice your breath flowing in and out, your abdomen rising and falling. Notice the rise and fall of your chest. Let your mind chatter away as if it's just a radio playing in the background. Don't try to turn it off, it's impossible. Not even Zen masters can do that. Just let it play on in the background and keep your attention on the breath. From time to time, your mind will succeed in distracting you. It will hook you in with a good story, and you'll lose track of your breathing. This is normal and natural, and it will happen repeatedly. The moment you realize this has happened, take a moment to note what hooked you, and then gently refocus on your breathing. As this exercise continues, the feelings and sensations in your body will change. There may be pleasant feelings showing up, such as relaxation, calm, peacefulness, and there may be unpleasant ones, such as boredom, frustration, anxiety, or backache. If you can allow those feelings to be exactly as they are in this moment, that would be great. Don't try to control your feelings. Just let them be as they are. Regardless of whether they are pleasant or unpleasant, and keep your attention on your breathing. Again and again, you'll drift off into your thoughts. As soon as you realize it, acknowledge it and refocus on your breath. This is not a relaxation technique. You are not trying to relax. The aim is to let your feelings be as they are, to feel whatever you feel without a struggle. So if you're noticing a difficult feeling, then silently you can say to yourself, here's a feeling of frustration, or here's a feeling of anxiety, or here's a feeling of boredom. Acknowledge it's there and keep your attention on the breath. So life is like a stage show, and on this stage are all your thoughts and all your feelings and everything that you can see, hear, touch, taste, and smell. In this exercise, you dimmed the lights on the stage and you focused a spotlight on your breathing. And now it's time to bring up the rest of the lights. This breathing is happening inside a body, so now bring up the lights on your body. Sit up in the chair and notice your arms and legs, head, neck, chest, and abdomen. And your body is inside a room, so now bring up the lights on the room. You can look around and notice what you can see and hear and smell and taste and touch. And notice what you're feeling. And notice what you're thinking. So there's a part of you in there that can notice everything, whatever you see, hear, touch, taste, smell, think, feel, or do in any moment. And that basically brings the exercise to an end. So you can take a stretch and we can talk about it. Although we're done talking about it because we talked about it first. So I'm going to go back to sharing the slides, and I'll just say a couple more words. There's 8 sections, and they go through those 6 processes, and they hit on a couple twice. And the idea is you're introducing, just these themes. And I tend not to approach it, act in a didactic way as much as I used to, which is always hard to teach in these settings because we talk about things didactically. And this is kind of an in-between didactic versus experiential approach. So, but that's a practice that you might use to introduce this notion to folks. So anyway, thanks for your attention. I'm going to turn it over to Karen, and then we'll have some time at the end maybe for some questions.
Thank you so much, Jonny. That was really wonderful. And it's really a wonderful introduction to what I'm going to do, which is move into talking about compassion. So we talk about mindfulness and compassion like 2 wings of a bird. And Jonny was talking about, he's talking about a lot of things, but one of the things he was talking about was mindfulness. And I'm going to be talking more about compassion, and specifically self-compassion. That's the work that I do with my research, as well as teach. I teach adults and I teach teens, and right now I'm teaching a young adult course. So we can go to the next slide, Jonny. Thank you. So I'm going to start to introduce you to the concept of self-compassion. We're going to do an exercise. And what I'd like to do, if you can just hit that again, Jonny. Yeah, thanks. So what I'd like you to do is think about a time when you've had a close friend who was struggling in some way. They had something happen that day that was very upsetting to them. It made them feel unworthy, inadequate, like a loser. Maybe it was something that happened at work, or something in a relationship, maybe something at home. And they came to you. And what did you say to them? What tone of voice did you use? And what kind of physical gestures or posture did you use? And if you can't think of a particular time, then imagine that this happened to you, or imagine a time then that this would happen to you. What would you say? And what tone of voice would you use? And I'll give you about a minute or so to think about this. If you have something to write with close by, you can even write it down. Okay. So now what I'd like you to do, just hold that for a second, and think about a time when you had a really hard day. When something happened to you that made you feel like you failed, you felt inadequate, you felt unworthy. Again, it could have been something at work or something at home, maybe something in a relationship. Jonny, you can go to the next slide also. Thanks. So how would you treat yourself? What tone of voice would you use? And what words would you say to yourself? And I'll give you a minute or so. Okay, everybody okay? Now, I'm curious, I'm interested in seeing what you discovered from doing this little exercise. I don't know if there's anybody who wants to share. Anybody want to share? Anything that you may have learned?
I'm happy to share. I don't think it's something that's new to learn about myself. It's something I'm continually working on. And I think a lot of people find this true. I know a lot of my patients do, but we often are very soft with others and quite harsh on ourselves. I think my statements, my kind of reflective observations are quite opposite in how I handle somebody else's hard day versus how I handle my own. And I'm very all in to help somebody else. And oftentimes I'll opt out when it comes to me having a bad day. I will try to zone out and not necessarily have to be in that moment anymore. So it's quite opposite.
Yeah. So thank you. Thanks, Rachel. So what we know is that about 80% of people are like this, are good friends than they are with themselves. And in fact, they say things to themselves that they would never in a million years say to a friend or say to anybody else. So one definition of self-compassion, and we can go to the next slide, Jonny, is treating yourself the way you would treat a good friend when you're having a hard time. And so we know most people don't do this. Most people are much, much harder on themselves. And we know that being hard on yourself is related to, of course, to stress, to depression, to anxiety. So some of the research studies now on self-compassion have shown us that self-compassion, people who are more self-compassionate are much less likely to be depressed, anxious, and stressed. So depression, anxiety, and stress are inversely correlated with self-compassion, and it's a strong inverse correlation. We know this is true with adults, and we know that it's true with teens also. There hasn't been a lot of research yet on kids, but we know from meta-analyses that have been done with adults and with teens that it is this strong correlation. So knowing that, what has been done is interventions have been designed to cultivate and teach people how to be more self-compassionate. And that's some of the programs that we teach, that I teach. I teach programs for adults, programs for teens. We have programs for healthcare communities. Specifically, I just finished a study with transgender teens. And so that's also modified curriculum, slightly modified curriculum. So we have all these different programs now that have been tailored for specific different populations, subpopulations, to teach people how to be kinder to themselves. Okay, you can go to the next slide. So the more formal definition of self-compassion has these three components. So the first component is mindfulness, which you've heard about. So it's having a balanced perspective and maintaining this perspective when you're encountering challenges and difficulties. So like you've had this difficult conversation with somebody at work, do you say to yourself, oh my goodness, that was really horrible. What an idiot I am. They're going to report to my supervisor. I'm going to lose my job. I'm not going to be able to get another job. It's going to be on my CV. You start kind of spiraling out, right? And we all have a tendency to do this. I'm sure you've seen this in clients. So mindfulness is having that balanced perspective and maintaining a sense of equanimity, really. So the opposite of that is what we call over-identification or catastrophizing. The second component is common humanity. And what common humanity is about is understanding that whatever it is that we're experiencing, whatever emotions we're experiencing, are part of just being a human being, alive, walking around on this planet in the 21st century. We tend to, and this might be really obvious, but when we're actually there, when we're actually experiencing that difficult emotion, when we're feeling stressed or depressed, we tend to forget that, oh, this is part of being human. We tend to think we're the only ones. Again, I'm sure you've seen this in clients. We tend to feel isolated. We tend to feel like there's something wrong with us, or what did we do wrong to end up in this place emotionally? So common humanity is just coming back to that understanding that, it's part of being human. And then the third component is self-kindness. The opposite of self-kindness is self-criticism, which of course is what we tend to do. We tend to be really hard on ourselves. And self-kindness has an active piece where we're taking an active step to just do something nice to ourselves, like we would do to a good friend. So say something nice to ourselves, or we teach what's called supportive gestures. So like what this person is doing, putting hands on the heart. Initially, this can feel a little awkward or uncomfortable because we're not used to doing it. We have other gestures that we teach people, like just kind of stroking your arms, or sometimes putting a fist over your heart. It's kind of a sign of strength, and another hand on top of it. But what we know is that, and I like to share this with people when I'm teaching, that there's a physiological component, that there's a release of oxytocin when we do these gestures, which is why we do them for other people. If a friend's having a hard time, we would think nothing of putting our arm around that person, or giving that person a hug, or patting them on the back. We do it for other people all the time, but we're not in the habit of doing it for ourselves, right? So, that's another thing that we can do to just be kind to ourselves. But we teach lots of different ways of, lots of different tools and skills in our different programs. So Johnny, if you can go to the next slide. So what I'd like to do right now is teach you one short practice that we teach in the first class in our self-compassion programs. At least we don't do it in the teen program, we do it in the adult program. And it's called a self-compassion break. So in order for me to teach this to you, I'm gonna have to generate a little bit of stress in you. So I apologize for that in advance. And it's because we do this practice when we're feeling a little anxious or a little stressed, and we start to feel that anxiety rising up, and we can go right into this self-compassion break. So if you're comfortable closing your eyes, you can go ahead and close your eyes. And think of something that you're dealing with in your life right now. that's causing a little bit of struggle or suffering for you. This can be a health problem, can be something in a relationship, can be an issue at work. You want to choose something that's kind of in the mild to moderate range. So, not the most difficult issue you have going on right now, because we're just learning. So, maybe something like a 3 or a 4 on a scale from 1 to 10. Something so that you can feel it in your body, that it's not causing too much stress. So, just imagine this situation. Who does it involve? Maybe who said what to whom? Trying to get a good image of it in your mind. And now saying to yourself, this is a moment of struggle. So we're just acknowledging what's here right now. This is the mindfulness piece. You could use other words if you'd like that connote the same meaning. So maybe something like, wow, this is hard. This is difficult. And now saying to yourself, struggle is a part of life. This is part of what it's like just to be in a human body. I am not alone. I'm not the only one who feels this way. And this is the common humanity piece. And then the last step of this practice, the third step, just saying to yourself, so may I be kind to myself right now in this moment. This is a self kindness piece. Maybe I should, or maybe I can say a few kind words to myself. Maybe words like, you'll get through this, or you're strong, or this won't be forever. And if saying these phrases feels a bit awkward to you, know that it's because we're just not used to doing it. It's new, not in the habit. And anything that's new feels a little bit awkward at first. And if you can't think of what to say to yourself, think of what you might say to a good friend who is struggling with something similar? What would you say to them? And can you say those words to yourself? So we're now at the end of this practice. Take a moment to notice what you're feeling. And as Jonny said earlier, allowing your feelings to be here, whatever they are. Not trying to feel one particular way or another. But whatever you feel is totally okay. And if your eyes have been closed, you can open your eyes. And so that's the self-compassion break. Again, it incorporates the 3 components of self-compassion and can be done in any moment of stress. I stretched it out so that you could see the 3 different parts, but in actuality, it can be done very quickly in a minute, 30 seconds, even 10 seconds. Now, this is a moment of struggle. Struggle's a part of life. So may I be kind to myself. Jonny took a self-compassion nap. Great. Can you go to the next slide, please, Jonny? Yeah, I thought that's where we were, Q&A. So any questions for either me or Jonny, or comments or observations or anything?
I want to thank you both. I mean, that was lovely. And I think all of us agree it's much needed on Thursday late afternoon to have some self-compassion and moments of peace in your mind at this point. My question for you both is, in your own practice, how do you incorporate these types of exercises with your patients, with your clients, when you intermix them with more difficult conversations that are not as experiential? So like Jonny mentioned, didactics blending with an experience like this, in psychiatric world, discussing symptoms, discussing medications, and doing exercises like this. In my practice historically in training and now in clinical world, I tend to kind of separate these pretty distinctly in different sessions completely, and rarely do I find it comfortable to intermix. And I know patients also find it somewhat disgruntling because it's such a different experience for them. How do you find it's best to blend some conversations that are not experiential with experiential exercises?
You know, I can go first because mine's going to be pretty short. I'm not a clinician, you know, I'm a researcher and a teacher. So I don't blend them. I just teach these different programs, and the programs do have didactics, and they do have experiential practices. So it's kind of structured that way.
So they're expecting first.
I'm sorry, that's probably not much of a help.
No, I mean, to me, it sounds like they're expecting a certain segment of the program to be didactic, and then you switch gears, and they know that that's going to take place in advance.
Yeah, I don't think they know. No, they don't know in advance. But what I'll do is I'll teach about a certain concept, loving kindness practice, for example. This is fresh on my mind. I just did it last night. So I'll talk about loving kindness practice, maybe mention the research, and then I'll say, so now we're going to do a loving kindness practice. Okay.
Yeah, I mean, sort of the good and the bad of being a psychiatrist who's interested in, you know, behavioral interventions, which include, in my opinion, mindfulness and, you know, self-compassion, loving kindness, all these types of things, as a radical behaviorist, right? What I've gone to, and Rachel was in my my vestigial stages of figuring out when you were still training, is I've just kind of changed my language, and I've tried to end pretty much most encounters with asking the person to commit to doing something important. You know, how small, just like when Karen was saying, like, pick a 3 or a 4 for something that's been a struggle for you. You have them pick a 3 or a 4 for something important to do, and it can be a 1. I don't care. It could be a 0.25. But the point is, you kind of end in this space of, when you say to someone, like, do what important thing do you want to do until we meet again, however long that's going to be. You know, it could be as small as, like, I want to, make a phone call or something, right? Which sometimes is not that small, but packed into that is all these processes, whether you're identifying them or not, because you're going to have lots of stuff show up, and then you might need a self-compassion break. But what's interesting is that these, the self-compassion itself is so powerful that I think if you can actually prioritize it, it kind of takes care of a lot of the other parts. And I think, since we're dealing with Western minds, though, like, at least maybe Eastern minds have the same trouble too, but problem-solving minds, sometimes we build in and add in some more stuff for them to know how to get to the self-compassion and where to put it in and this sort of stuff. And so anyhow, I've been trying more and more to shift towards, when it comes to medications, the languages, this decreases the impact. This is something that helps it be less of a problem, not, this is going to target that, and this is to take care of that. And then more experientially, sort of prompting folks to take some kind of action that they want of their choice, which has values and acceptance, and of course diffusion, and taking care of yourself and everything all built into it.
Thanks.
It's a challenge to move from a formulaic approach to these things, but it just takes practice and figuring out how you want to inhabit whatever the approach is. Because, as you could tell, when Karen is leading these practices, it's like it's from a place of just it wholeheartedly believing in them, right? And that resonates. And so that's the space that you want to get to with whatever modality resonates with you. And once you get into that space and you're taking care of yourself enough to stay in that space. I mean, there are times when, like Karen was saying before, she didn't get a lot of sleep last night. It doesn't really show, but but I don't do a lot of this work at the end of the day, because at the end of the day, the compassion meter is low. Or if I do it at the end of the day, I'm making sure what I'm doing in the earlier part of the day is not as strenuous, hopefully.
Yeah, when I teach classes, first of all, I like not teaching at the end of the day. And the end of the day is the evening, because a lot of times we teach classes in the evening. But if I know if I have an evening class, then I'll have to do something not strenuous during the day, or take a nap.
Yeah.
Because you have to be 100% present.
Mm-hmm.
And there's no cutting corners. Doesn't work.
And I think that's just the truest statement. I mean, for me, ACT has helped me to reach more people, because it kind of secularizes stuff that a lot of folks are put off by. But luckily the culture is shifting on this. But even before I really learned ACT, and I was really just practicing a lot, and I've always incorporated loving kindness with my open meditation. I just was lucky that way. This guy teaches that. But I just found that my presence was just so much more, effective. And I didn't, at the time, didn't really need to have like a real, clear guide of which way to go, because you were just witnessing and, being with and making choices. And that's all there really is to do. And you could, challenge whatever the story was the person was saying in such a compassionate way, because it was just, you were there. And that's hard to maintain. It really is. That's the work.
It's practice, it's that's why you have to practice. I work a lot with teachers also, and it opens a whole other door to lots of issues. But in order to really teach people this stuff, whether you're a psychiatrist or a teacher or whoever, you have to be practicing it yourself. And you have to be grounded in the practice. And you have to, because of what Jonny said, you have to be able to be present. I've trained a lot of teachers who, and I mean, mindfulness teachers or self-compassion teachers who, it comes from their heads, or it comes from a cognitive place rather than an embodied place. And in order for the message to get across, it's got to be embodied. It just doesn't work another way.
Yeah, it's true. So, what I found with this, and I'm sure Karen would say something similar, but we'll see, is that when I'm practicing well, I'm in a different kind of space and it kind of flows just much more naturally. And you're just more accepting of your limits, and that's okay. And when you're not, when I'm not in those spaces, I, am rushing to things and I'm intellectualizing things and I'm getting stuck much more frequently. And so you have to emphasize your own, well-being and presence and your boundaries, your limits, all these things. And so when I first started a real formal practice years and years ago, I had to go to bed earlier, and I had to not use as many intoxicants, and I had to just actually take care of myself and prioritize that. And when you do these types of things, like, you develop such compassion for yourself, but so quickly it goes to others because they're struggling with these things that you're just now starting to figure out. And your life just kind of changes when you prioritize these kinds of ways of being, because it has to, because you can't not prioritize it. And one of the first teachers I ever had is like, this has to be the priority. And I remember that my response to that was just like, well, what about my family and my work and all this stuff? And I just didn't get it at first, and it's really hard to prioritize. I'm not going to say, like, I'm not at, like, I'm probably like at like 60% lately, I'd say. So. Well, I think we're low on time. Does anyone have anything else they want to ask about, or?
And before people headed out, also, I wanted to make sure that everybody knew who everyone was on the call. I know several of us know each other, but I don't know that I recognize Lance, you, or Lindley either. Do you all mind taking just a moment to introduce yourselves?
I'm Lance Waycaster. I'm act psychiatrist on UNC Acting.
Good to meet you. Thanks for being here.
And I'm Lindley. I am a new hire, and I'm working in the Vilcom Center as a social worker there.
Oh, cool. Welcome.
Those of you who don't know me, I'm Rachel Frisch. I'm an adjunct faculty who's now working in private practice in the community. Psychiatrist. And Mike Kane, if he's around, he might be with his kiddos. Mike, are you around?
Yeah, hey everybody. I am sort of double duty, but this has been a great experience for all the moments that I was able to experience with y'all. Thank you for doing this.
I will say it helps to start these practices before kids or after they're bigger, because in between, John Kabat-Zinn pretty famously said, like, every kid's an 18-year mindfulness retreat.
I love that. No, I remember when I started practicing before I had kids, and I remember when my newborn baby would wake up, whatever time I got up to practice, she would get up 5 minutes later. Yeah, I used so much loving kindness to, like, rock our first child back to sleep at 4 a.m. You know what I mean? It was just loving kindness, because otherwise it was unrepentant rage, It really worked. I used to practice when I put them to bed 3 hours. I remember it would take 3 hours every night to get them to bed. Fun.
Holy cow, that blows me out of the water.
But they sleep really well now. They're 26 and 29.
Wow. Yeah, they internalize it. Yeah.
We both survive.
Great sleepers.
And this kind of work helps us get through that, right? With our patients or with ourselves. So we appreciate it so much. Thank you both, Karen and Jonny, for being here. And it's good to see you both.
Yeah, nice to see you.
Do you have any questions? You gave Sam your PowerPoint presentation, I would imagine. Did you email Sam your PowerPoint from before?
Oh, I will. Yeah, I hadn't yet. And there's a couple extra slides that Karen had in here. And so, we can just leave those. And
Yeah, you could
Is that
either
okay?
leave them or take them out, whatever you want to do.
Okay. All right.
Well, it's good to see everyone. Thanks so much for joining us. Have a great rest of your evening.
Thank you.
Thanks.
Thank you
Yeah.
all.
Take care, everybody.
Good night.
Bye-bye.
Is there anybody else on?
Sam is in the background, but I think she's tending to something else, but she's like the host. So I think she'll probably just,
It's interesting
Shut
because
down.
I can't see. Now I can see who's on because the whole time I couldn't see who was on.
yeah, you can do that little view clicky thing and you still can't
Right.
see everybody at once. But I think we had like 5-6 people.
Yeah.
It
Yeah.
was a small number, but I mean,
That's okay.
doing this stuff at the end of the day, I can't blame anybody.
Yeah, 5 o'clock and be like, ugh. I know.
I've always been kind of, doing it Monday at noon. Everyone's always like, why are you going to do it on a Monday? And I'm like, I'm kind of belligerent about it. I should move it off on Monday, to be honest. But
People
you
don't
know.
want to do Mondays.
I mean, you know how Monday is. Everyone's like, oh my God, there's so much to catch up on, But I've always challenged that and just been like, I know, but if you just take a break, you might find that's not actually true. It's no different than the rest of the days. But that's fine.
It's sort of good to start the week that way.
That's what I always thought, but I think I was just lazy about it because, the alliteration of Mindful Monday just works, right? And then you're like, what are you going to go with, like Thoughtless Tuesday or Think Less Tuesday? I mean, it just doesn't work as well. Thursday.
Well, Wellness Wednesday.
Wellness Wednesday would be good, but see, Wednesday we have a stupid meeting every time. So anyhow, I just knew I couldn't do it in the morning because even though I'm a morning person, since we have little kids, our mornings are totally unpredictable, right? Like one of them's going to have poop in their pants or something. So anyway, I thought it was really good. I think with some practice, we could even make it a lot better. I thought it was great. I loved your practices.
Yeah.
They were wonderful.
Yeah, it was fun. Yeah, it was fun. Yeah, I'd be up for doing it again.
Yeah, we'll see.
Sure.
All right.
All right. Well, have a good evening.
You too. Take care.
You too. Bye.
Thanks, Sam.